my name is Lauren Foster, and I did my study on the effectiveness of semantic feature analysis. My cooperating SLP was Jennifer Barnes, and my faculty mentor was Dr. Susan Benson. Over 800,000 people suffer from CVAs, or more commonly known as strokes, every year in the US. That is why it is crucial for SLPs to find effective stroke treatments. Several studies were used to formulate my research question. One in particular was called the semantic feature analysis, incorporating typicality treatment and mediating strategy training to promote generalization. All of the participants showed difficulty with word retrieval. Improvements in the naming accuracy of trained items occurred for several of the participants. Another article showed that children with language difficulties can increase their word knowledge through intervention. A different study showed that using cueing hierarchies can enhance written naming. The participant in my study was a 9-year, 4-month-old boy in the 4th grade who attended an urban public school in Oklahoma. The participant had a stroke at 7 years of age with right lobe gray matter, heterotopia, and epilepsy. His most recent seizure was in April of 2018. He had a resected brainstem hemangioma. The participant had absent drop seizures and cranial nerves 6 and 7 palsy. He had a rare genetic disorder that has not been identified yet. The participant had a history of hydrocephalus due to a midbrain cavernous angioma and post-hemorrhagic stroke. He had recently been diagnosed with a hearing impairment and used both hearing aids and an FM system. The participant had a central auditory processing disorder and attention deficit hyperactivity disorder. The research question asked, does the use of a SFA chart and verbal cues improve naming abilities in a 9-year, 4-month-old male who had suffered a CVA? To answer this question, an A, B, C, C, B, C design was used. The participant was asked to verbally label picture cards that he knew receptively. In this study, the independent variables were used of the FSA chart, and the second independent variable was verbal cues. The dependent variable was the participant's naming abilities with the words that he knew receptively. During the baseline phase, his naming ability was 10% accuracy. After establishing a consistent baseline of 3 treatments, or 3 baseline sessions, the treatment phase began, which included both independent variables. Before the first treatment session began, a teaching session happened where I taught him how to use the chart, what the chart looks like, and the verbal cues that would be used with the chart. Then the BC1 phase began, including both variables, where I would place the picture in the middle of the chart, ask him verbal cues along with him using the chart, and there's no trend line that began. After 3 sessions, he still had 10% accuracy. So then I moved to the C1 phase when I dropped the verbal cues and just had the chart to see if he would be able to focus better with just the chart. And no trend line was established. After 3 sessions, he still had only 10% accuracy, which then proved in the study that the use of a semantic feature analysis chart and verbal cues did not improve his naming abilities in the 9-year, 4-month-old male who had suffered a CVA. This study included only 1 participant, and it probably would have been more beneficial to include more participants with varying ages and abilities for more diverse data. An older participant might have had more word knowledge and maybe was more familiar with the features of the word that were targeted. And the participant also had ADHD and central auditory processing disorder. More sessions maybe would have allowed him more time to process and attend to the activity, and maybe would have been more successful if I included more participants with no other known comorbidities that might have resulted in higher success rates. Also, the study was performed during COVID, even though it was hypothetical. Still, we were doing in-person and virtual sessions. His attendance was poor, and we had things like slow internet. I was wearing a mask and a face shield, and we had a plastic barrier between us. Even though he was using an FM system, all of those could have been just poor results on our study. But however, semantic feature analysis is a well-studied and successful treatment method for adults who have suffered CVA. However, more research should be done in children who have also suffered a CVA, and they should trial the semantic feature analysis. Thank you, and this is my poster.